Thanks for staying with us here. TV5 News at 9 continues with Medical Moments with Covenant Healthcare. And joining us again this morning, we have Nurse Laura Walker. We appreciate you being here. We are learning so much about just simple ways, simple little tips that can make the difference and save lives. And today we are talking about the Trauma Center at Covenant and the Stop the Bleed program. We should mention Covenant is recognized as a regional level 2 trauma center for both adults and children. If you could explain basically what is a trauma center and how does it serve the community?
So it's an important thing to have a trauma center in your community. So a trauma center is a hospital that specializes in taking care of patients that have had a traumatic injury. Traumatic injuries are the #1 leading cause of death for those ages 1 to 44 years old. And injuries are from falls, they're from car accidents, they're from gunshot wounds, they're burns. So they affect us, not only the injury itself, but the recovery period. So trauma is a sudden change in someone's life. So it's good to have a center that specializes in taking care of those.
It's also neat because you focus on preventing traumatic injuries as well. You mentioned some of those common injuries. You know, what can people do to avoid them and stay safe?
So part of the responsibility of being a trauma center is having someone that works on preventing injuries so that they don't come in, so we never have to see them. So there's many things we can do to prevent injuries, and one of the programs we kind of work on is Stop the Bleed.
Tell us about that. You partner with the Saginaw Police Department and others.
Yes, so Stop the Bleed is a national initiative. It started after Sandy Hook Elementary School shooting. What they realized is that sometimes people have survivable injuries if the person next to them knew what to do. And if the person doesn't have any medical training and they don't know what to do, a lot of times what they choose to do is either nothing or freak out. So the thought process between Stop the Bleed was, let's just teach everybody what to do in those first couple of minutes before help arrives, to help change an outcome in someone's life. It can be less than 5 minutes if someone has a serious injury that they can lose a lot of blood. So it's teaching the layperson how to either hold pressure, pack a wound, or put a tourniquet on until help can arrive. And it's very empowering for people.
Tell us about your kit.
So Stop the Bleed kits come, and our ultimate goal is to put a Stop the Bleed kit next to every AED out in the community.
Oh, wow.
So those are the automatic defibrillators. That way, let's say you were at the Dow Event Center and something happened, you would know where the first aid equipment is. It's all in one spot. Inside of here becomes gloves, a tourniquet, and then bleeding control supplies, gauze, packing, and a marker. So those are the things that you would use to help control bleeding if someone was injured.
And with a tourniquet, where is the best, how does that work?
So tourniquets only go on arms and legs. Those are the only place that you would put them. The majority of the time, holding pressure will be enough. So take whatever you have. Whether you have a Stop the Bleed kit, if you don't, and all you have is the dirty t-shirt in the backseat of your car, it is okay to use that, because we are not worried about infection right now. We're controlling bleeding. We can give them antibiotics later at the hospital, but we need you to help provide that first aid so they're able to get to the hospital.
Oh, wow.
So that's what's in the Stop the Bleed kits, and they're scattered throughout the community. Covenant offers classes to teach this skill. It takes less than an hour to learn it. And we also partner with Saginaw City Police, and we will come in together and do a presentation where they talk about how would you respond in an active shooting situation to keep yourself safe, to keep others safe, and then how would you help provide first aid until help arrived.
And what is the best way if a group or community organization wants to get some training like that? What's the best way to do that?
They can either reach out to Covenant Healthcare or they can reach out to Saginaw City Police.
All right, and that also goes for schools as well?
Yes.
All right.
Churches, any community groups. We've really worked hard to promote this throughout our community to help keep it safer. Increase awareness.
But that's interesting. If somebody does start bleeding badly, you say put that, put something on it. Try to hold that in.
Yep. So we're going to start with holding pressure. If it's not controlled with holding pressure and you know how to, you can apply a tourniquet, and you put the tourniquet on the arms and legs, and it's very similar to putting on a belt. Wow. So anybody can learn it. We teach this to school-age children. Like a second grader can do this.
Wonderful. Well, thank you for being here, and we have your contact information in hot links, so go look right now. Go to WNEM.com. Right at the top of our homepage, you'll see hot links. Click Click on that and it'll have the details you need to get in touch. Thanks for being here. We are back in just a moment.